If you've ever been in a hospital bed and wondered why a nurse suddenly raised your head, turned you on your side, or asked you to sit leaning forward, this video is for you. As a nurse, I can tell you we don't move patients randomly. Every single position has a medical reason behind it, and sometimes your life depends on it. By the end of this video, you'll understand the main patient positions used in hospitals, when each one is used, and exactly why nurses are trained to use them. In a hospital, patient positioning isn't just about making you comfortable. It's a critical part of your care that directly affects your breathing, your blood circulation, your digestion, and even preventing painful pressure sores. It also keeps you safe from choking or aspiration. One wrong position can actually worsen a patient's condition, but the right one can literally save a life. It's that important. Let's start with the most common one, the supine position. This is simply when you're lying flat on your back, facing upward. We use this position for routine examinations, after some surgeries, and for basic rest and sleep. But here's a crucial nursing note. We almost never use this position for unconscious patients. Why? Because the tongue can fall back and block the airway, which dramatically increases the risk of choking. Next up is one of the most important positions in all of nursing, the Fowler's position. This is when a patient lies on their back, but the head of the bed is raised. You've probably seen this a million times. It comes in a few variations: low Fowlers, where the head is just slightly elevated; semi-Fowlers, which is the most common at about 30 to 45 degrees; and high Fowlers, where the patient is sitting almost upright. We use this position for so many things: helping patients who have difficulty breathing, feeding patients safely, and managing heart and lung conditions. If a patient ever tells me, "Nurse, I can't breathe well," putting them into a Fowler's position is often the very first thing I do. It works wonders. Now, what if someone is in severe breathing distress? That's when we use the Orthopneic position. In this position, the patient sits upright and leans forward, often supported by pillows or an overbed table. Think of someone with a severe asthma attack or advanced heart failure. This position helps the lungs expand to their absolute fullest capacity and takes a huge load off the muscles you use to breathe. It provides immediate relief when someone is struggling for every breath. Let's move on to the lateral, or side-lying position. As the name suggests, the patient lies on their side, either left or right. This position is absolutely critical for patient safety, especially for unconscious patients or anyone who might not be able to protect their own airway. It helps prevent aspiration, which is when saliva or stomach contents go down into the lungs. It's also one of our main tools for preventing pressure sores, as it takes the weight off the back and tailbone. A variation of this is the Sims position. Here, the patient lies on their left side, with their top leg bent sharply towards their chest. It might look a little specific, but it's a very functional position we use for certain nursing procedures like rectal examinations, giving enemas, or administering suppositories. It provides excellent access and is more comfortable for the patient during these procedures. Next is the prone position, where the patient lies flat on their stomach. You might have heard a lot about this during the COVID-19 pandemic. This is not a routine position. We use it for patients with certain severe lung conditions, like acute respiratory distress syndrome, or RDIS. Lying on the stomach can help improve oxygenation by opening up different parts of the lungs. But it has to be done under very strict monitoring because it can be risky if not managed properly by a trained team. Now for a position that looks a bit dramatic, the Trendelenburg position. This is when the patient lies on their back with their whole body tilted so their head is lower than their feet. We use this for short-term management of shock or hypotension because it uses gravity to help improve blood flow back to the vital organs like the brain and heart. It's important to know this position isn't safe for everyone, especially patients with head injuries, and we use it very cautiously and for short periods. The opposite of that is, you guessed it, the reverse Trendelenburg position. Here, the patient is on their back, but the entire bed is tilted, so the head is higher than the feet. This is useful for patients with acid reflux, as it helps keep stomach acid down. It's also used to reduce pressure inside the head after certain surgeries and can help with breathing in some situations. Finally, let's talk about the lithotomy position. This is when the patient lies on their back with their legs raised and supported in stirrups. It's used almost exclusively for childbirth, gynecological exams, and some urinary procedures. It provides the necessary access for these specific situations, but it requires very careful support to avoid putting strain on the hips or causing nerve injury. So, you might notice nurses coming in to turn or reposition patients every couple of hours, especially if they can't move on their own. This isn't just to make them look neat in the bed. We do this to prevent those painful pressure ulcers, improve blood circulation throughout the body, and reduce complications like blood clots and pneumonia. Repositioning is a core nursing responsibility, not just some routine task. Every time a nurse adjusts your position, it's a deliberate clinical decision. It's not guesswork. These positions are powerful tools that support healing, prevent complications, and in many cases save lives. So the next time a nurse asks you to turn, sit up, or lean forward, you'll know that it's a crucial part of your care, your safety, and your recovery. If this video helped you understand a little more about what goes on in a hospital, please share it. Educating patients and their families can save time, reduce stress, and sometimes even save lives. Thanks for watching, and subscribe for more real-world nursing education.